needed at certain point. So the main reason for conducting such programs and events are to unleash the things that are unspoken and to take away the lack of awareness. So this is the main reason we are going this, and there are certain events being to handle like bladder cancer digital world tour, and we are also in a part of that. So the main motto is to spot the symptoms and overcome any barriers to speak the medical advice. And some see they are contact as a common thing, and some don't find it is important to make it a note on it. So wishings and greetings for the students and everyone who are taking part of it. Thank you so much for your participation. Thank you so much for your presence. So, congratulations. This is not just a competition, it is a spark that teaches you how to spread the awareness about it. So, take it and implement it. With that being said, let's move on to the e-poster presentation competition. I'm welcoming all the participants and especially the special greetings to our judging panel members. In no particular order, let me introduce all the judging members to you. Dr. Anita, Assistant Professor at DVCP Kerala. She completed her PharmD from the Daleview College of Pharmacy and Research Center. Currently, she is working at the same institute for with experience of 4.6 years. Welcome, ma'am.
Thank you.
And then our second judge will be Dr. Aishwarya, Assistant Professor, Department of Pharmacy Practice, Kripanidhi College of Pharmacy. She completed her PharmD from the Oxford College of Pharmacy, Bangalore. She is an university rank holder in subjects like pharmacotherapeutics, jurisprudence, and hospital pharmacy. We are privileged to have you here, ma'am. Welcome, ma'am.
Thank you so much, Jennifer.
And next, Dr. Sri Vishwapal Shivakumar. He is a team leader and critical care clinical pharmacist at Sri Ramakrishna Hospital, Coimbatore, Tamil Nadu. He is a member of Infectious Disease Society of America, FCPI member, and antimicrobial steward. He completed his PharmD from Sri Ramakrishna College of Paramedical Science, Coimbatore, did his internship as a clinical pharmacist at Ramakrishna Medical Center, and clinical pharmacist at Harvey Specialty, Coimbatore, Tamil Nadu. Currently, he is a clinical pharmacist at Sri Ramakrishna Hospital. Such certifications include basic life support for healthcare providers by American Heart Association, advanced cardiovascular life support by American Heart Association, antimicrobial stewardship accountant by Base Approach WHO, hospital management ICU by Allison, health outcomes of drug-gut microbiota interactions by European Accreditation Council for Continuing Medical Education, diagnostic and therapeutic protocols for dyslipidemias by Spear Medical Education, antimicrobial stewardship, a course for healthcare providers by OAZIS Health. And he secured second prize in ID quiz in first international ID quiz issued by Federation of Clinical Pharmacy India in November 2023. Welcome, sir.
Thank you for the warm greetings.
And then that's it. They are our panel members for today. We are so pleased to have you. And let me tell you the rules for today. The theme is optimizing bladder cancer treatment, pharmacist perspective, or the impact of lifestyle modification on bladder cancer prevention. And you will be called according to your slot number. At that time, unmute yourself, start sharing your screen, and then present it. Time will be strictly 5 minutes, and if it crosses 5 minutes, we will be stopped, and then uh, the 1 minute will be given for the panel members for the discussion. So make sure to present yourself, express yourself, use the time wisely, and its time is 5 minutes. So with no further ado, let's move on and let's get into that e-poster presentation competition. The first participant will be Sheikh Abdullah Kabir Hai Twins Me from Raghavendra Institute of Pharmaceutical Education and Research. Sheikh Abdul. The slot number will be SYCCONRX S48001. Sheikh Abdul. It's your time. Your time starts now.
Good evening, everyone and all. Myself, Kabir Hadi. Today, I am going to present my poster presentation on advancement in AI and machine learning for early detection of adverse drug reactions, and it is a predictive model in hospitalized patient. So, basically, AI, artificial intelligence, it is so much advancement. It is taking so many advancement and taking right now. So I'm going to share my work, which is an AI predictor of adverse drug reactions. So first of all, in the introduction, uh, I'm going to tell that adverse drug reactions causing many morbidity and mortality and economical expenses to the patient. So to decrease such difficulties to the patient, the detection of ADRs prior before prescription is mandatory. So, by predicting the ADRs before prescribing can make the patient less to reduce the expenses and decrease morbidity and can lead to decreased mortality also. So, this current literature focuses on identifying the risk factors of ADRs by existing prediction models often followed in the short timely detection. Like advanced AI and machine learning models offer promising avenue for early ADR detections. So this AI model we can see in this picture. It is a like illustration how the this AI predictor model works. So we have so many models in our market. So if we enter the drug name, it can give some ADRs prior. So what such type of ADRs can be seen by users of such drug. So we have so many softwares and databases in our market. But what's the same? I think they these both are matching same. So what's the difference? So the difference is so here this model is the has taken the patient as the center. So based upon the patient conditions and the conditions and how his specifications are. So this model predicts the ADR according to that. So as ADR is not only is a problem of the drug or the dose, it is also like the physiological factors of a body also affect the occurrence of ADR. So this model works on that basis. So how can we trust this? So it can go wrong and it can predict the wrong ADRs which can lead to more suffering. So how can we trust this? So to supporting this model, we have a research conducted by by the pharmacy students of Onfor Lopez University Hospital from Brazil. So here, four pharmacy students and three clinical pharmacists conducted a study in which they have took 343 patients and with adverse drug reactions. So and for those 343 patients, 668 control using observatory methods. So here they took 343 patients with some sort of ADRs. They took this from a Brazil hospital, and the inclusion criteria of these patients are patients hospitalized for more than 24 hours, receiving at least one medication. And exclusion criteria is patient admitted for ADRs, transplants, chemotherapy, and ICU stays and pregnant women. So this is the inclusion criteria of the population we are taking in the study. So now we have used some tools which we collected the data from the patient, and those data is modified and converted into a structured digital like computerized data. For our better understanding, it is like computerized data. So the first of all we should know about what is machine learning. Machine learning is an uh, algorithm. It is an algorithm which learns the unstructured data or structured data which we give it to them. So it takes the data and converts it into an analysis, predictions, or classification. It depends upon how we give the command. So here
Sorry,
another
Kabir,
thing we
your
should.
time has come to an end.
Okay.
It's now over to the panel members.
Yeah. So can you just open your slide again? Am I audible?
Yes, sir.
Yes, sir.
Can I just see the slide again?
Yes, sir. Yes, sir. Is it
So
visible, sir?
yeah, it's visible. So yeah, your presentation is fine. Your presentation was good actually, but yeah, this AI tool is
Sir, it is not.
actually yeah.
Yes, sir, it is not relevant to the theme. Yes, sir.
Yeah, it's actually not relevant to the theme, but still, yeah, the presentation is very good actually. Something what would I say is AI is always a boon for the boon and also a ban for our human generations because it actually reduces the work of a normal person, but it also means it is a ban like it takes the work of many people's, right? So many of us will won't be having any jobs when you're going to use this AI. So have you ever used this
No,
machine learning and found any areas in your sector, in your hospital sector?
no, sir. This is not implemented, but it has tested by those study conducted by those Brazil students. They have conducted study and approved the like it is predicting actually predicting. So the accuracy is nearly up to 80%.
So it's
So
about 80%.
according to the study conducted by those Brazil students, it is predicting and it can be utilizable.
Okay. So the clinical pharmacist students were you four of us, the names has been mentioned, right? You all the four has participated in the study.
No, sir. Actually, it's uh, I have took the guidance. Those are the guide names which I have took in my college. So I have mentioned their names, and it is referred from two articles, two three
Okay.
articles.
Okay.
The study is from single articles.
So this till the AI is on the process for implementation.
Yes, sir.
So other two judging panelists can make your view.
Thank you, sir. Good evening, Kabir.
Good evening, ma'am.
Kabir, your presentation was good, but I would like to gain some clarity on what is random forest and boosting trees. Could you please explain?
Madam, they are the machine learning algorithms. Ma'am. There are so many algorithms which learns in a different way. Learns in a different way and predict the some data in a different way. So there are many algorithms. Out of those many algorithms, our gradient boosting trees and random forest. These are algorithms which makes the trees like decision trees. Nearly we have took nearly 5,000 decision trees which we given to that data. So the data here is patient physical examination data, height, weight, body weight, everything. Like we write in a case sheet, those data is given to the algorithm. That algorithm makes the decisions. Like there are 5,000 trees which makes the decisions. Out of those cumulative, it makes a single decision. So it learns and make its own algorithm.
Okay, so these are the tools for analyzing the demographic data by segregating them. So, what is
Yes,
their
ma'am.
actual work?
Basically, they take the data of the patient. Like
Okay,
first of all, it can be explained in like two steps. Ma'am. First, we are giving the data to the algorithm. It from
okay,
the data we are giving the patient name and patient details with what ADR it have came to the patient. That's the
okay,
data one. It
okay,
learns from them. The algorithm learns from them and creates its own algorithm. And
okay. So, it,
after creating the algorithm, if we give the new patient data by the
okay,
referring from the past, which past data we have given to the algorithm, by referring
okay,
that and from that learning, it predicts from our present data.
Okay. So from subjective demographic data, we're just going to get some information and then segregate it later and conclude, right? So that we can take future reference.
Yes, ma'am.
Okay. Okay. Thank you, Kabir. Over to the
Thank you, ma'am.
next.
Hi, Kabir.
Hi, ma'am.
Am I audible? Okay. The work
Yes,
is so
ma'am.
nice. An excellent work. I do have one doubt. Can we get the data regarding all the severity, that is mild, moderate, major, all areas we will get the data?
No, ma'am. It needs some sort of extra programming. It is a like a simple prototype, ma'am.
Okay,
So
okay.
it is like if this happens, like if there is statement, if else there then statement. If this happens, then it will happen. So basically, it works on that principle, ma'am. So if you want to include, we can we can program and we can develop it also.
Okay, one more thing. We while entering the demographic data, we will enter the other predisposing factors also, no? That comorbidities and polypharmacies.
Yes, ma'am. Basically, there
Okay,
are
okay.
36 variables, ma'am. Out of 36, it refers and gives the date prediction.
Okay. Thank you. Thank you.
Thank you, ma'am.
Thank you, Kabir Hadi, for presenting. And next, our next participant, Deepa J. Mele from SETS College of Pharmacy, Karnataka. Deepa, SYCCON S48002. Deepa, you can present now.
Good evening to panel members and all the family members. So the introduction part, my theme is on optimizing of the bladder cancer. And the introduction is here, the bladder cancer is a type of a cancer that begins in the cell of the bladder, the organ in the pelvis that stores the urine. And it's one of the most common cancer, especially in older adults. And the signs and symptoms involved under this bladder cancers are the blood in the urine, frequent urination, pain during the urination, incomplete emptying of the bladder, and tired, that is the fatigueness, and bone pain, swelling feet. And the risk factors involved here are smoking. The smoking is one of the main factor which is involved under the bladder cancer, and the exposure to the certain chemicals and the age. And the diagnosis it involves is cystoscopy and biopsy and even TURBTE, which is abbreviated as transurethral resection of bladder tumor. So TURBT is and one of the important and mostly used for this bladder cancer. It is an operation to remove an early cancer in the bladder. So and it requires the 6 weeks to heal after the TURBT operation. And after this TURBT, there will be some bleeding and pain when a patient going to urinate. And this is mainly takes place, I mean, this TURBT is taken place at the stage 1 of the bladder cancer. And under the types of the bladder cancer, it involved transitional cell carcinoma, squamous cell carcinoma, and adenocarcinoma. And this bladder cancer is involved under the transitional cell carcinoma, as it is involving it involves the connective tissue. And the stages involved under this bladder cancer are 5. That is, the stage 0 is the precancerous lesion of inner lining. Stage 1 is the cancerous tumor have spread into connective tissue, and the stage 2 is the tumor have spread into the muscular wall, and the stage 3 is the spread into the local or the regional organ or into the pelvic lymph node, and the stage 4 is the cancer has spread into the major organ. And the treatment, it mainly depends upon the stage and the type, but it can include the surgery, chemotherapy, immunotherapy, or the radiation therapy. And prevention. The prevention of this bladder cancer can be done by quitting of smoking, and stay hydrated. I mean, drinking plenty of the fluids may help to dilute the concentration of the cancer causing agent in the urine and limit the exposure to the harmful chemicals. For example, we can take the arsenic, which that increases the bladder cancer. And healthy diet. The patient who is suffering from the bladder cancer can take the fruits and the vegetables that can reduces the risk of the cancer. Regular medical checkup. The routine checkup help to detect any potential issues early. And here, according to the theme, as I went, according to the perspective of the pharmacist, how the bladder cancer can be treated. So there are numerous terms involved for the treatment of the bladder cancer. That is medication management. Under this, the pharmacist plays an important role, ensuring that the patient receive the correct medication, understand their usage, and manage the potential side effects if they are present, which includes chemotherapy and also the drug like cisplatin or immunotherapy drug like atezolizumab, that is of the monoclonal antibody. And the another one, immunotherapy drug, that is the combination of gemcitabine and doxycycline. And then the second one is the patient education. So the pharmacist ensure that the patient receive the correct medication, understand their medicines and potential side effects, and importance of adherence to the treatment plans. And the third one is pain management. Pharmacists help to manage the pain associated with the bladder cancer through appropriate pain medication and counseling with their use. And monitoring. Pharmacists monitor the patient for drug interaction, ADRs, ensure the proper dosage adjustment based on the individual patient characteristics. And the nutritional support. Advising the patient to change or to maintain the required dietary requirements and
Thank
supplements
you,
that
Deepa. Your time has
thank
been over. Moving to the judging members.
Hello, Deepa. So, yeah, your presentation is actually good. It's quite informative in the initial stage. And the first question, what I wanted to ask is, um, so what will be your major role in the optimizing this bladder cancer treatment? So you have mentioned that to check for the proper treatment is going for the patient or not. Rather than this, what will be your major role will be playing in the chemotherapy?
sir, that is providing the patient education, sir, and checking of the ADRs if present. And even the combination of the drugs can be given so that the ADRs if present can be reduced by the combination of the drugs.
Hmm.
And
Okay.
nutritional support.
Okay. So in case of if you witness any kind of areas, so what will be your next choice on what will you do after once when you're finding a new area?
Firstly, I will check it that is the ADR is from the disease. I mean, the bladder cancer, or is it from the treatment or the tablets which is conducting. So by checking it out, if it is from the treatment, we can maintenance of the dose can be done by seeing their age and all. And if it is from the I mean cancer, or that the therapy what the patient has been taken, we can go for the next therapy, sir.
Okay, so you mean you'll go for a secondary therapy or second dose therapy will have a less area, right? So that is what you wanted to mean here.
Yes, sir.
Okay, thank you.
Yes, thank you, sir.
Maybe next panelist can.
Good evening, Deepa.
Good evening, ma'am.
Deepa, your presentation was really good. Your poster is also really fine. Deepa, from a point which you had mentioned in the poster, I would like to ask you a question from the poster itself. There's a column that says dosing optimization, right? So here we are going to monitor certain parameters. Okay, can you just list out what mainly we will be monitoring? Which parameter we will monitor for bladder cancer for dosing optimization?
Uh, Here the main one we will see is that age, ma'am, under the bladder cancer.
Age.
Yes, ma'am.
Mm, have you heard about therapeutic drug monitoring?
Yes, ma'am.
Okay, that is, you have written about dosing optimization. So in dosing optimization, we'll be considering the age because you have mentioned something else factor, not age. There's
No,
a
ma'am.
particular parameter which we'll focus on.
In the dosing, we will not consider age, ma'am.
Yes. But when sir asked also, you told the same answer. That's why I'm asking once again. For dosing optimization, what will be the main parameter we are going to look upon? Renal function test, no?
Yes, ma'am, we
Mainly
will see that
bladder cancer.
because
Yes.
this only occurs in the urothelial bladder, urothelial cancer, it's said to be.
Yes, exactly. Okay, you have also mentioned it in the poster. That's why I focused on that. Anyways, Deepa, it was good. Good presentation. Keep it up.
Yes, ma'am.
Over to the next
Thank
judge.
Okay. What's the recurrence rate of this bladder cancer?
Yes, ma'am.
What's the recurrence rate? It will occur again and again?
Um, no, ma'am, it will not occur, but by this as I said, the TURBT, the transurethral resection of the bladder tumor, is one of the main option and the important option which can be held for this bladder cancer. And most of this, 95% of the patient can be, corrected by this TURBT, ma'am. If it though happens
Only
again,
with that
the
or along with chemotherapy or radiation?
yes, ma'am, we can also use the chemotherapy, immunotherapy, and also the radiation after only going through this TURBT.
Okay. It's a nice presentation. Thank you.
Thank you, ma'am.
Thank you, Deepa. For the participants' convenience, I think they couldn't make up the time with 5 minutes. When your 4 minutes come to an end, I'll intimate you that you have 1 minute more. Make sure to complete your presentation within that 1 minute. So I'll intimate you when your 4 minutes has come to an end. Okay. Next, move on to the next participant. Rajput Akashing Narendra Singh, Sonia Education Trust College of Pharmacy, Karnataka. Rajput Akashing. SYCCON RX S48004. Rajput, it's your time.
Yes, ma'am. My poster visible.
Yeah, it's visible. And your time starts now.
Good evening, ma'am and sirs. RX Doctor, SYCCON Season 4, Lifestyle Modification for Bladder Cancer Prevention, present by Rajput Akash. Introduction, bladder cancer also carcinoma cancer that begin in the cancer. This cancer typically affect older adults. It is usually diagnosed early when it is still treatable. It likely to rescue, so follow-up tests are typically recommendable. 7 cause of bladder cancer: smoking, chemical exposure, family history of cancer, inflammation in the bladder, increasing age, consumption of high fat foods, previous cancer history,
Risk factor of bladder cancer, lifestyle change and risk factors. Some factors associated with in increasing risk of heart disease are also linked into high risk of bladder cancer. Smoking and tobacco use are two lifestyle factors that fell into this category. It is important to stop smoking and stop using tobacco in order to reduce your risk. Risk factor of bladder cancer, gender, age, smoking, and working areas. Working areas, benzodiazepine chemicals use morely. Lifestyle change to reduce the risk of cancer, avoiding smoking, stay fit, healthy, eat healthy, use screening, prescribing, practice personal hygiene, get vaccine, limited alcohol intake, schedule screening. What would help reduce bladder cancer? The American Cancer Society state that some research indicate the diet in fruit and vegetable may be reduce the risk of bladder cancer. Will not all study agree with these findings? Following certain benefit, eating habits has many health benefits, including reducing the risk of other type of cancer. Vegetables, crucius, uh, uh, cruciferous vegetable, leafy greens, orange, yellow, and red pigment engines, tea, green tea, oolong tea, and black tea, fruit, citrus fruit, berries, and melons, organic food, organic eggs, organic lee and poultry, organic produce. What fruit is good for bladder infection? Do not eat a lot of acidic fruits such as organic lemons, orange lemons, and or limbs during the infection. They can irritate your bladder. However, once your infection is going, eating acidic fruit with vitamin C can help prevent future infection. Add grapefruits and strawberry to your diet along with spinach and green peppers. Discussion and conclusion. What lifestyle choice can you make in attempt to prevent cancer? Once you go to those down, move on to the others. Maintain a healthy weight, exercise regularly, do not smoking or use smokeless tobacco, eat a healthy diet, limited alcohol, zero is the best, protect yourself from the sun and avoiding turning beds, protect yourself from sexual transmitted infection, get screening tests. If possible to reduce the risk of developing bladder cancer, some behaviors such as avoiding smoking and maintaining a balanced diet can reduce the risk of developing the condition. Some risk factors such as a person
1 minute more.
uh, such some risk factor such as a person age and family history of bladder cancer are unavailable. I'm finished.
Well done. And now over to the judges.
Hello, Mr. Rajput. So, yeah, your presentation was actually good. And so, so what you wanted to tell from the presentation? Because I don't see things which is relevant to pharmacy. It's everything related to your lifestyle modification,
Yes, sir.
mainly your food intakes.
Hmm.
So, as a pharmacist or as a clinical pharmacist, what will be your role in it?
So as a pharmacist, patient counseling, sir. मतलब pharmacist.
Patient counseling. Okay. Mhm. So, and you have mentioned that certain acidic content of the food can cause bladder cancer, right?
Yes, sir.
So, have you ever? Is there any mechanism behind it, or it's just an article which shows those things? How could an acidic content of the food can
बहुत है सर
cause
मतलब both, sir.
both? I didn't get you.
Oops. More in articles.
No, I didn't.
Sir,
More than.
more an article mentions, sir.
Okay, okay, fine. Okay, thank you. Over to next
Thank you.
judge.
Thank you, sir.
Um, Good evening, Rajput.
Yes, ma'am.
Your poster was really clear and it was a very well done poster. Presentation
Thank
also
you.
was very good.
Thank you,
You
ma'am.
were focusing on lifestyle modification for prevention of bladder cancer or for people who have already got bladder cancer and how they should modify their lifestyle. Was it prevention or was it for increasing the quality of life?
Ma'am, prevention भी है. Both more
Prevention.
focusing on, ma'am, both more focusing on prevention.
Okay, you were focusing on prevention more. Okay.
हाँ.
So it is a generalized poster, right? It is not for people who are suffering from bladder cancer, but a generalized poster, which is like an awareness, right?
Yes, ma'am.
Okay, thank you. Thank you, Rajput. Thank you.
Thank you, ma'am.
Over to the next judge.
Hi, the presentation was good. Has given a brief information regarding the lifestyle modification that we have to follow. Actually, it was nice, and many information was new to me also. But can you say the usage of continuous usage of meat have any effect on bladder cancer?
Excess fat, ma'am. Excess fat level.
Okay. Okay, it was a nice presentation. Thank you.
Thank you, ma'am.
Thank you, Rajput. And next participant, Archana Reddy. Rajput, you can stop sharing your screen. And our next participant, Archana Reddy from Mala Reddy Institute of Pharmaceutical Sciences, slot number SYCCONRXS48006. Archana Reddy, your 5 minutes starts now.
She's in mute, right?
Archana, we couldn't hear you. Are you there?
Rachana?
Archana, we can see your screen. You can start presenting.
Is I'm audible?
Yeah, you are. Your time begins now.
My name is Archana Reddy and I'm from 6th year from Mala Reddy University, Hyderabad. And my topic is optimizing bladder cancer treatment and pharmacist perspectives. And bladder cancer is a significant global health concern characterized by the growth of the malignant cells within the tissues of the bladder. And the bladder cancer is one of the most common cancers globally. According to the WHO, it is the 10th most common cancer worldwide. And more than half of the million people are diagnosed with the bladder cancer. And more than 212,000 dies because of the bladder cancer. And there are three types of bladder
cancers, and translational cell carcinoma, which is the most common type arising from the urethral cell lining of the bladder, and squamous cell carcinoma, and it is the less and often associated with the chronic inflammation and irritation. And adenocarcinoma, it is rare and arising from the gradua cell within the bladder. And now come to symptoms and diagnosis. Common symptoms include blood in urine, frequent urination, pain during the urination, and lower back pain. And diagnosis is, it is typically confirmed through cystoscopy and imagining studies such as CT or MRI. And bladder cancer is the most challenging and expensive cancer to diagnosis. And risk factors are smoking. The most significant risk factor is responsible for approximately half of all the bladder cancer causes. And even who exposed to earlier industry chemicals, particularly aromatic amine, using dyes and rubber industries, these people increases the high risk of causing the bladder cancers. And even the chronic inflammation, which is infection to the bladder cancer, bladder and stones, and age and gender also has the high risk, particularly in the individual over the 55 years. And let's see how the optimization of a bladder treatment for the pharmacist perspective involves the patient receiving the most effectiveness and safety therapy with managing side effects and interaction with the other medications. And medication management include chemotherapy regimens, ensuring the correct dosing and scheduling the chemotherapeutic agents like cisplatin and gemcitabine and carboplatin. Pharmacists help to prevent the medication errors and ensure the adherence to prevent the protocol. And immunotherapy, which monitors and manages the immune checkpoint inhibitors like pembrolizumab and alzolizumab. This includes to understand the specific side effects and need to early intervention in the case of adverse reaction. And targeted therapy, which stay update to novel targets therapies and ensuring appropriate patient section and monitoring. And managing the adverse effects includes chemotherapy, which includes the nausea and vomiting, providing appropriate antiemetic regimens, and nephrotoxicity, monitoring the renal function closely, especially with agents like cisplatin, adjusting dose or switching less
1
nephrotoxicity
minute
is
more.
necessary. And even drug interactions and reviewing the medication history containing through medication, recounseling and identifying the potential drug-drug interaction even with the food, and adjusting the comorbidities, modifying treatment plans for the patient with renal or hepatic impairment and other comorbidities condition. And supportive care like pain management, optimizing and controlling with appropriate analgesics, which avoid the opioids when possible to prevent the issues, and nutrient supplements, nutritional support. Recommended to take the nutritional supplements and dietary modification to manage the weight loss, and hydration, ensuring that the patient is taking the adequate hydration to prevent the nephrotoxicity, especially with cisplatin. And
Thank you,
patient
Archana.
education.
Your time has come to an end.
Okay.
Over to the panel members.
Hello, Archana. So your presentation was actually short and it is actually brief through your poster.
Yes.
I personally like that poster presentation. And
Thank you.
yeah, so I just wanted to ask you one more thing that who who are more prone for this bladder cancer? Is it male or female?
Males, sir. More commonly, males are affected than women. 3:1.
3:1 ratio. Okay.
Yes, sir.
Mhm. Okay. So you have mentioned about monitoring the side effects and medication reconciliation, right?
Yes, sir. Yes, sir.
So how could you help a patient if a patient is on side effect? If any kind of side effects like any kind of allergic reactions happens with an anaphylactic reactions happen with an chemo drug, how will you manage the patient?
Mm, checking the inhibitors
With I didn't get you.
with. Yes, sir.
Hello.
Yes, sir. Can you repeat it, sir?
So in case if a patient comes with an side effect like anaphylactic reactions with a
Yes,
chemo
sir.
drug, so how will you manage the patient? Whether you will continue the same chemo or you'll move on to the next secondary treatment.
We'll reduce it, sir, with giving adjusting the dose.
Okay, so you'll reduce the dose and will start your treatment, right? That's how.
Yes, sir.
That's what you meant. And one thing which I liked is you mentioned about the medication reconciliation. So most of the centers are not doing that medication reconciliation, I guess. So that is very
Yes,
much important to understand the drug interaction which is happening in a in a which is happening frequently in all sectors.
yes, sir.
Okay. So yeah, thank you so much. Over to next panel.
Thank you, sir.
Good evening, Archana.
Yes, ma'am. Good evening, ma'am.
Good evening. Your presentation was very good, and your poster was very simple and very beautiful. It was a very nice, informative poster. Very good.
Yes, ma'am.
Archana, I would like to focus on one point you told, that is that the main diagnosis is cystoscopy, right?
Yes, ma'am.
Okay, so can you give some insights on the procedure, how the procedure is done?
And it is it is examined with the in the lining of the bladder through tube.
Okay. What is the tube called? It has a name.
Mm, I have no idea about it. Really.
The tube is called a cystoscope. Okay. For collecting the
Okay.
biopsy samples, they use this cystoscope to collect the samples.
Yes, ma'am.
Okay. Thank you, Archana. Over to the
Thank you, ma'am.
next.
Hello.
Yes,
Yeah, the
ma'am.
presentation was really good, really good. I do have one doubt. Can we provide immunotherapy to all the patients, or there any selection criteria for that?
Excuse me, ma'am. Can you repeat it?
Is there any specific criteria for giving a patient with immunotherapy, or we can provide it for all the patients?
No, ma'am. Specifically, we should do examine, ma'am.
What examination?
Yeah, like confirming with the like
Okay. Do you know about BCG, BCG treatment in bladder cancer?
no, ma'am.
Okay, just look into it, okay? Otherwise, the
Yes, ma'am.
presentation was really, thank you.
Thank you, ma'am.
Well done, Archana Reddy. Thank you. And over to our fifth participant, Aisha Sultana from Nirmala College of Pharmacy. Slot number SYCCON S48008. Aisha Sultana from Nirmala College of Pharmacy.
Is my screen visible, ma'am?
Yes, it is.
Okay. Can I start?
Yeah, you can. Your 5 minutes starts now.
Good evening, panel experts, and good evening, everyone. I am Aisha from fifth year family. Now I am going to present an e-poster on the impact of lifestyle modifications on bladder cancer prevention. So as we all know that bladder cancer is a type of cancer which begins in the cells of the urinary bladder, lining of the urinary bladder. And this bladder cancer is of 5 stages. Like first it starts in the lining urothelium layer, and then it spreads to other organs as the stages proceed. And if we see the bladder cancer, it is the ninth most common cancers occurring in the worldwide, and it is mostly seen in men when compared to women. And the treatment of this bladder cancer is also challenging, and it is somewhat expensive too. And the main diagnostic procedure for this bladder cancer is cystoscopy procedure. And most of the bladder cancers are diagnosed at early stages in 75% of people. And in 25% of people, they are detected somewhat in later stages. If we see the etiology, there are some modifiable risk factors and some non-modifiable risk factors. First risk factor is smoking. Uh, Most of the people who smoke, they have high risk of bladder cancer, as the chemicals of these cigarettes or smoking, while they are smoking, they get accumulated in the urine and they increase the risk of bladder cancer. And in chemical exposure also, we can see the risk of bladder cancer is high. And in familial history, the persons who are having family history of cancers, they may also have the chance of having bladder cancer. And inflammation in the bladder, increasing age will also cause bladder cancer. And consumption of high fatty foods, it may also cause a risk factor for bladder cancer. And previous cancer history. Coming to clinical manifestations, if we see, um, the patient will have blood in urine. The patient will experience painful urination, pelvic pain, back pain, and he will have frequent urination. And now I want to focus on the lifestyle modifications of bladder cancer patients, like who are suffering and living with bladder cancer. Bladder cancer impacts many aspects of their lifestyle, day-to-day lifestyle. About 8 in 10 people survive bladder cancer for at least for 5 years. And now I want to focus on which lifestyle factors are affected in these people, so that we can change those lifestyle factors and increase the quality of life in the patients. The first one is mental health. The people suffering from bladder cancer, they may get depression as they are living with the cancer. And another one is they will not have control on their bladder and bowel. This will make them feel embarrassed and insecure, and 50 to 80% of the time they will be getting frequent urination and they will feel embarrassed to be in the surrounded by people. And depression is also most common symptom. 8 out of 10 people in having bladder cancer, they will suffer from post treatment depression. And the next one is relationships. And the people having bladder cancer, it will be very hard for them to open up about what they are going through, as they cannot express themselves to others, and they will feel very self-conscious about their body changes, about after having the bladder cancer. They will be afraid of talking, coming into people. And the next one is work style, work area. The people working who are having bladder cancer, when they go to work, they will they need to go to urination frequently, and they need to have proper accommodation, and they need to adjust with the workplace.
One
This
minute
makes them,
more.
and the diet also, they will, as the cancer patients will have very less appetite, they need to focus more on diet. And as they will undergo surgery, it will affect the bowel function and what they eat. And most of the men suffer from bladder cancer. As I said, uh, men are more prone because they have smoking habits, and they are working in the areas like chemical industries like that. And tips for coping: the patient should be kind to themselves, they should express their feelings, they should become a whole care person, they should join into communities and seek support from the people who are living with the bladder cancer. And as May month is awareness month for bladder cancer, we should create more awareness among these patients, so that they will have some support, that they can cope up with these all the habits, and they can change their lifestyle and they can improve their lifestyle and have a good quality of life. So great awareness is very
Thank you,
crucial,
Aisha.
and we people. Okay, thank you.
Excellent presentation. Thank you. Moving on to the judges.
Hello, Aisha. Um,
Hello, sir.
yeah, you can just show your present your screen, I guess.
Okay, sir.
So how will you correlate the poster you presented now with the theme?
Well, these lifestyle changes, when patient suffers from bladder cancer, these lifestyle changes are affected. So if they change these lifestyle in their daily day-to-day life, and they can be a better person, like they can improve their diet, they can have mental support, their bladder function will improve. Thereby, they will not feel embarrassed and they will have a hope that they will live for some more years.
Okay. So what will be your point or what will be your major role in preventing the bladder cancer for the society? So what will you do?
Uh, as a clinical pharmacist, we should provide patient counseling to the patient, and we should explain all the things about their diet, their medications, and what to eat, what not to eat, and we should support them emotionally, like emotional support, and we should help them join into community groups, like with similar people who are suffering from bladder cancer. And by joining in those groups, they will be expressing themselves and they will come up more.
But this is something which once when you diagnose a patient with bladder cancer, you'll be providing all those counselings. So in order to prevent bladder cancer to occur, so what all the things you'll be doing?
Like they should stop smoking firstly, and the people who are working in chemical industries, they should reduce their exposure to those chemicals. And the diet, they should change their diet, and they should go for continuous regular checkups, and they should take proper medications. They should be under physicians eye so that they will control the cancer growth.
Okay. Okay. Thank you so much. Over
Okay,
to next judging panel.
Good evening, Aisha.
good evening, ma'am.
Aisha, your presentation was crystal clear. Even your poster is also very nice. Though your title says it is the impact of lifestyle modification in cancer prevention, you also focused on people who are actually having bladder cancer and the stigma they are going through when it comes to mental health, right? Because of embarrassment,
Yes,
right?
ma'am. Yes, ma'am.
So I would like to get some insights on, as a pharmacist, what is your role in breaking the stigma among these men or female, whoever is suffering from bladder cancer.
Firstly, the pharmacist should not make the people embarrassed by his or her facial expressions.
Okay.
They should understand them and they should explain them clearly, like this is a common thing, and they should provide emotional support, and they should help them to join into communities with the people who are suffering from similar bladder cancer, so that they will express themselves and they will not feel shy, first of all, ma'am. Like,
Okay, Aisha. Thank you. Over to the next judge.
Hi, Aisha.
hi, ma'am.
You have told for the prevention purpose, you have to undergo regular checkups. For the
Yes.
prevention,
Well,
what are checkups? What are checkups specifically for bladder cancer will you suggest?
after coming to certain age, like 45, 55, from there the people should get regular checkups, so they people will not understand what the changes are going inside the body. So for this bladder cancer, they can undergo urinary test, urine test, blood test, and they can undergo any CT scan like that. They should check for renal function tests, kidney function tests, and liver function tests as general examinations which a human need to go. So thereby they can detect earlyly and they can prevent them.
Okay, the presentation was nice. Thank you.
Thank you, ma'am.
Thank you, Aisha Sultana.
Thank
And
you.
now to our sixth participant, Sheikh Shihanas from Nirmala College of Pharmacy, lot number SYCCON RXS48009. Sheikh Shihanas from Nirmala College of Pharmacy.
Good evening, panel members and my dear fellow presenters. Am I audible?
Good evening, you're audible. You can share your screen.
And let me share my screen, please. Is it my screen is visible?
Yes, it is.
Thank you. Is my screen is visible now? My presentation?
Yeah, your poster is visible and your time starts now.
Thank you. Good evening, everyone. Firstly, I appreciate the team RX Doctors and I am very thankful for being given this opportunity to present my poster presentation. Let me go to the screen. Today, I am presenting on topic of impact of lifestyle modifications in bladder cancer prevention. Firstly, we should know what is the bladder cancer and what are the symptoms of this and what causes this cancer. Bladder cancer is in the sense an abnormal growth of tissues in the bladder, and the most commonly seen symptom is blood in urine, and this bladder cancer is mostly prone for men than compared to women, and it is 4 times more in men than compared to women. And the common symptoms includes pain and burning sensation during urination, changes in bladder habits, uh, and loss of appetite, feeling tired or weak. And what are the risks associated with this bladder cancer are smoking, exposure to chemicals, fried meals and fried foods, and other infections that are related to the lower extremity part. Next, how to reduce this risk of bladder tumor. In the poster, the left below and the right side part of the poster represents the ways to prevent the risk of bladder tumor, and these are the steps to prevent the bladder tumor. And as you can see, the risk and the causes are exactly look like our lifestyle scenarios. So we should change our lifestyle habits. The lifestyle habits, which includes the main thing is smoking. Smoking can increase the risk up to 2 to 3 times. Risk up to 2 to 3 times. And the chemicals which is present in cigarette is nicotine that will goes into the urine through the blood, which can damages the bladder. And this nicotine enhances the mutations by inhibiting the DNA repair. Next, moving to the diet for bladder cancer patients. Diet is also a lifestyle and very important for every human to maintain healthy life. And these are the three superfoods which helps in bladder cancer. This first one is garlic. It is rich in antibacterial property. It is rich in antibacterial property. It is very good if we take if the patient had any other infections in lower extremity like urinary tract infections and the problems in kidneys. And next, strawberries are rich in vitamin C and also contains water which will help to stay hydrated. And green leafy vegetables, if the physician said the patient to do not take vitamin C foods, then he should go with the green leafy vegetables, which are rich in vitamin C, fibers, and calcium. Fiber can helps to have regular bowel movements, and it is very useful in GI tract. And And these are the bladder irritants, dairy products, acidic foods, alcohol, tomato-based foods, citrus fruits, chocolates, and spicy foods. As these foods have more acidic in nature and less pH, so they can irritate the bladder. And these are the drinks for the healthy bladder. This left side part is the drinks which irritate the bladder. Those are caffeinated teas, and these citrus contains drinks. And these are non-caffeinated drinks, water, and the herbal trees, etc. And next,
1 minute more.
moving to profession. In profession comes a person with bladder cancer who works at industries like rubber mining, and the persons like painters should reduce their exposure to certain chemicals. Uh, Certain chemicals. And the next thing is active physical lifestyle. And the patient who diagnosed with bladder cancer should do the physical activity like swimming. Swimming can relax the muscles of legs, and which will helps to reduce the inflammation and pain in that part. So conclusion of my poster presentation is implementation of these lifestyle modifications plays a pivotal role in preventing the bladder cancer. And these lifestyle changes not only reduces the risk of cancer but also promotes a overall health and well-being. Thank you.
Very good, you're on time. Very good, appreciate it. And now over to the judges.
Hello, Saik. Your
Hello, sir.
presentation was actually very good. It was very much interesting, and what I had in mind means what I expected was there in the presentation. Those mechanism of how a smoking can cause bladder cancer. Still, it's an in-depth mechanism, but still, from a student side, it is better to know at least these kind of mechanism. It's actually your presentation is very much good
Thank you, sir.
and very explanatory also.
Thank you very much, sir.
And and the same question which I wanted to, which I asked the other participants. So, what will be your role? What will be a clinical pharmacist role in prevention of bladder cancer?
As a clinical pharmacist, we had the main role in the hospital is the patient counseling part. In the patient counseling part, uh, we need to explain about every drug, and those, and with the drug effect of the drug, and also while taking with those drugs, how should we have to change the lifestyle modifications, as the lifestyle changes are included in this treatment. So we have to tell to the patient about the lifestyle modifications too with that of the treatment.
Okay, so this is for the patient who are diagnosed with an bladder cancer, right? So I am asking for the patient, how will you uh, give an awareness, or how will you provide information to a general public to get rid of bladder cancer?
As these causes and risk are mainly related to our lifestyle modifications, sir, lifestyle scenarios. So we have to change this lifestyle. If the patient or any other non-patient is also smoking, we have to tell them about the smoking causes like these effects in the body. And these mostly the people are taking this outside food, and we have to say in the outside food there are many carcinogens, so we have to stop taking carcinogens. And if the people who are exposing to chemicals like painters, the professions like painters, and they are in rubber industries, mining industries, we have to say as a clinical pharmacist, please do wear a mask, and wear gloves to your hands, and clean your hands and your total body after the work. Like we have to say like that, sir, for the patient, and all, as well as patient and non-patients also, sir. Like this, we have to create awareness about this bladder cancer, sir.
Okay, thank you, and it's actually a wonderful presentation. Over to
Thank you,
next.
sir.
Good evening, Shehnaz. Your presentation was really good and your poster is perfect. It is a very well-defined poster. Congratulations on the poster.
Thank you, ma'am.
As I want to know, you mentioned the ratio, male is to female ratio, and how this is, occurring in males. It is 4 times when compared to females, right?
Yes, ma'am. Yes,
That
ma'am.
is what you mentioned, yes. So, can I know what could be the possible reason why this is like that? Why males are more prone to bladder cancer compared to females?
This smoking is very important risk and cause for the bladder cancer, ma'am. And the
Okay.
men are more prone for smoking, ma'am, than compared to women. And this main cause says that they are more prone than compared to women, man. And their sexual lifestyle also changes in men, man, than compared to women. And these industrial works also changes, ma'am, because the women won't work in those. Mainly, women don't work. Uh, in the sense, I mean, men are more working women. Sorry, ma'am. Men are more working in industries than compared to women, ma'am. And the painters are also the men only, ma'am, as we can see outside, ma'am. So these lifestyle scenarios we can observe more in men, ma'am, than compared to women, ma'am.
Okay, absolutely. But I also would like to add a point that hormonal pathways are also a main factor in this. When compared
Yes,
to females, how these hormones, the androgens, how it reacts in the male pathway, right? Hormone pathway is one of the reason. Okay. Thank
yes,
you so
ma'am.
much, Shahnaz.
Sexual. Yes, ma'am.
Yes,
Thank you,
right.
ma'am.
Over to the next judge.
Hi.
Hi,
I do
ma'am.
have one.
Hello, ma'am.
Is there any relationship between urinary tract infection and the urinary bladder cancer?
Yes, ma'am. There is a relation, ma'am. As I mentioned in risk factors and causes, urinary tract problems, ma'am. The urinary tract problems includes infections in urinary bladders, and those extremities, lower extremities, ma'am. If there is infection in those urinary tract, they can be more prone to get chances of more mutations. If there are more infections there can be chances of less DNA repair, and they will cause more mutations, ma'am. So, like this urinary tract infections may also prone for bladder cancers, ma'am.
Okay, your poster is well arranged and you presented it very well. Congratulations and thank you.
Thank you, ma'am. Thank you so much, ma'am.
Thank you, Shahanas. And now,
Thank you so
next,
much.
a seventh participant, Hirija R.A. from the Erode College of Pharmacy and Research Institute, SYCCON RX S4 80010. Hirija from the Erode College of Pharmacy.
Good evening, ma'am. Is my screen visible?
Good evening, Hirija. Yours is visible. You can start presenting. Your time starts now.
Good evening, panel members. My theme topic is lifestyle modification of bladder cancer prevention. Here, the symptoms of bladder cancers are blood in urine and pain or burning sensation during the urination, difficulty in passing urine. These are the certain symptoms. And while moving to the causes, the first cause is smoking and other tobacco use. That is, smoking can worsen the symptom of overactive bladder and the interstitial cysts. Tobacco smoke can damage or change the cell's DNA. And the next is consumption of high-fat foods. The immune cells mainly go to areas of body where there are a lot of fat cells. This leads to inflammation. That is fat tissue produces the excess amount of estrogen, high level of which have associated with increased risk of breast, endometrial, and ovarian, and also some other cancers. And the next is inflammation in the bladder. An infection caused by bacteria is the inflammation. Chronic or repeated urinary infection or inflammation cause the bladder cancer. That is long-term use of urinary catheter, also a risk of cancer. Next, exposure of chemicals, especially at work. Chemicals called aromatic amines such as benzidine, beta-naphthylamine, 4-amino biphenyl that is used in dye industry can cause the bladder cancer. Most percentage the people work in chemical industry cause these cancers. And avoiding water intake. Drinking less water makes urine more concentrated. That is, the concentrated urine and less frequent mixation increase the exposure of bladder urothelium to urinary carcinogens. That is, promoting the development of bladder cancer. And the last point is overweight. As we have already seen, the fat cells produce the immune cells cause fat consumption cause the bladder cancer. Here, the overweight also cause the bladder cancer. That is inflammation. Immune cells go to the areas of the body where there are lot of fat cells. While moving on to prevention, first, quit smoking. Quit smoking not only reduces the risk of bladder cancer, also it lowers the risk of 12 type of cancers, that is lung cancer, larynx, oral cavity and pharynx, esophagus, pancreas, bladder, stomach cancer, liver, cervix, kidney, etc. And the second point is stick to a healthy diet. Eating fruits and vegetables has long been known to provide a health benefits. That is, fruits and vegetables contain many vitamins, minerals, and antioxidants, which decrease the risk of cancer. And the next is manage aggressively. That is, take enough time to fully empty the bladder while urinating. Drink plenty of water. Stay away from foods that bother to irritate the bladder. That is, avoid caffeinated beverages, carbonated beverages, and spicy foods. And the next is limit your exposure to chemical in the workplace. As we already see, the exposure to chemicals, it causes bladder cancer. So avoid the limit of exposure in chemicals. Then the next topic is next point is drink plenty of water. The amount of fluid consumption may reduce the exposure of bladder epithelium to carcinogens by diluting the urine and increasing the urination frequency. That is, drinking more water helps to balance the salt and sugars within the body, flush out toxins and waste products through the urinary system. And the next is exercise regularly. The physical activity may protect our bladder cancer through biologic pathway, that is enhanced immune function and decreased inflammation. And the physical activity also indirectly prevent the bladder cancer by reducing obesity. Thank you.
Thank you, Hirija. Thank you. That was a lovely presentation. And now over to the panel members.
Hi, Girija. So your presentation was actually good. It's like differentiating what are the causes and how to prevent all those causes. It's actually very good. And I have one question for you. You have mentioned about this
Yes, sir.
urinary catheter which can cause bladder cancer, right?
Sir?
You mentioned about this urinary catheter can cause bladder cancer, right?
Yes, sir. Long-term
So
usage, sir. If some
we are seeing.
bedridden,
Okay.
if the patient is bedridden, so long-term usage for 7 years, 8 years, it also a cause for bladder cancer, sir, risk of cancer. Long-term usage.
Okay. So the long-term usage causes risk of bladder cancer, right? Okay. Fine.
Um,
That's all from my side. Actually, a good presentation. Thank you. And over to next judging panel.
yes.
Good evening, Hirija.
Good evening, ma'am.
Hirija, it's a very good poster. I mean, it's a very clear poster. Just by looking at it, we can understand what you're trying to explain, and your explanation also was on point. I would like to know what would be the early symptoms a person would experience when he is, diagnosed with bladder cancer.
The patient will have blood in urine, ma'am. While urinating, blood in urine will be there, and pain or burning sensation during the urination. And the patient will be difficult while passing the urine, ma'am. They could not freely. They could not able to pass the urine. They will have pain and irritation, burning sensation, ma'am.
Okay. Okay, Hirija, good presentation. Congratulations. Passing to the next judge.
Hi. In
Hi,
the
ma'am.
risk factors, you have told that urinary infection may lead to bladder cancer. Can you specifically say some bacteria that have the higher risk of causing bladder cancer?
Ma'am, and bacteria cause the infection, that is inflammation in the bladder. So when the inflammation occurs in the bladder, it is a chronic. If it is chronic inflammation or repeated urinary infection, the patient already has, it leads to bladder cancer, ma'am.
Yeah, I have asked you, are there any specific bacteria which is causing the urinary tract infection that have the high risk of causing bladder cancer? And most commonly, E.
Yes,
coli
ma'am.
or something
Repeated
causes
urinary.
okay, only repeated or not any specific bacteria has the highest risk.
No, ma'am. Repeated urinary infection or inflammation in the bladder that cause the bladder cancer, ma'am.
Okay, the presentation is well and the poster is simple and it was very good. Thank you.
Thank you, ma'am.
Thank you, Hirija. And next, our eighth participant, Ritu Yadav from the Erode College of Pharmacy, slot number SYCCON RXS48011. Ritu Yadav from the Erode College of Pharmacy.
Good evening, everyone. Is my poster visible?
Yes, it is. You can start presenting. Your time starts now.
Okay, thank you. So my topic, I'm going to present on the impact of lifestyle modification on bladder cancer prevention. On before going to my poster, let me briefly give introduction on bladder cancer. So it is just a common malignancy that originates in the tissue of the bladder, the organ which is responsible for storing urine, as we already know, and it predominantly mostly affects the older adults. In majority cases, for individuals who are above 65, and the early symptoms of this bladder cancer is the hematuria, which is the blood in urine, which is the first sign of this bladder cancer, and also frequent urination and painful urination and pelvic pain can be accompanied. And diagnosis for this test we can do through urine analysis, cytology, cytoscopy, and CT scans may be able to find the bladder cancer. So let me come back to my poster. As we can see here, there are certain things which shows which are the risk factors. So it is always better to prevent. As we know the saying that prevention is always better than cure. So here are the certain things which we can prevent from bladder cancer. The first most important thing is smoking. As smoking cigarettes, cigars, or pipe may increase the risk of bladder cancer, as they have many harmful chemicals which may accumulate in urine. So when we smoke, these chemicals goes through smoke in our body and excretes some of them in the urine. So these harmful chemicals may damage the lining of our bladders, so which may increase the risk of cancer. And also the increasing rate, it is found in various studies that those who are age above 50 and 60 are the more prone to attaining the breast bladder cancer. So it is better to always do the regular checkups and screening. And comparing the gender wise, male are more prone to get the bladder cancer compared to women. Many studies show that male gender are 4 times likely to develop the bladder cancer than the female. So And another thing is the workplace. Many of the people, those who work in the certain areas which contains industrial chemicals, for example, in the manufacture of dyes, rubber, leather, textiles, and paint products, they contain certain chemicals which may increase the risk factors of the bladder cancer, like benzidine and aniline dye. So it is always better for these people to precautionarily work there and always have their regular checkups. And certain times it is also better to maintain good hygiene and to drink lots of plenty of water and eat a healthy diet, and also to limit the consumption of fast food and other processed foods which are high in fat, starches, or sugars. And also should limit the consumption of sugar sweetened drink. And I wanted to add many other points, but the word limit was only 150, so I had to stop here. So I will just explain. Certain times the previous cancer treatment may also increase the risk for bladder cancer. For example, many studies have shown that the cyclophosphamide has the increased chances of increasing the bladder cancer. And also in chronic bladder inflammation or infection also we can find the chances of increased risk of bladder cancer, as the long-term use of catheter may also increase the risk of the bladder cells. And also certain microorganisms like cyanobacterium and staphylococcus also are associated with this thing. And it is always better to know our family history of cancer, so it will be better in screening up the regular checkups and all those things. And even though if we are not able to prevent the this bladder cancer, the treatments may start from surgery, which is used to always remove the cancer cells, and also chemotherapy is also done. And for the
1 minute
bladder cancer,
more.
there has for the bladder cancer, the intravesical chemotherapy has been done, and radiation therapy, immunotherapy, and targeted therapy has been done for many times. And for immunotherapy, these were the drugs which were used more: avelumab, BCG, and nivolumab. So thank you. So it is better to always prevent the all these risk factors for this bladder cancer awareness month. Thank you.
Thank you. Thank you for the nice presentation. Now over to the judges.
Yes. Hello, Ritu. So your presentation was again a very good presentation. Something which is mm, the same, but it has a good amount of pictures which explains about lifestyle modifications and how to prevent it. And
Thank you, sir.
one question for me, you have mentioned about this intravesicular and targeted therapy, right? So is it both are similar or both are different?
Sir, intravesical chemotherapy, sir, in the lining of the bladder, they tend to treat the cancer, sir.
So what is that? What is then about targeted therapy?
Sir, in that the cancer cells are specific cancer cells are targeted during this treatment, sir, to kill them.
Mm-hmm. Okay. So okay. So the next question which I had is, you mentioned about this healthy diet, right? So
Yes, sir.
considering the generation right now, how will you
Yes, sir.
change them to change the person to go with an healthy diet, follow the healthy diet?
So
So
it's
right now we
always
are using many high fats and oils and all those citric acids, all those things we are using right now. So changing abruptly to healthy diet is actually a biggest task, I feel like. So how will you ask these generation peoples to change their diet? How will you
sir.
modify those diet?
So it's always better to start by slow progression, sir. I mean, these days everything is contains preservatives and all those things. So the first step is to avoid eating foods in outside places and to eat the home cooked meal, which can be prepared by ourselves. So this is the first step which we can start uh, by campaigns and all those things towards the youth who may not take seriously about their life and lifestyle and all. These days, smoking and eating lots of fat containing foods and all the preservative foods has been increased. So it's always better to increase these, to always suggest these things by including some campaigns and to show them the seriousness of these diseases, which may be done through the diets.
Okay. Okay. So very well explained. And yeah, thank you. Over to next judge.
Thank you, sir.
Hello.
Yes, ma'am. Good evening, ma'am.
Good evening, Ritu. So my question is like you repeatedly kept telling that prevention is better than cure, right?
Yes, ma'am.
So as a clinical pharmacist, tomorrow if you're going to do patient counseling, so who would be your target patients on whom you're going to do the counseling to prevent a bladder cancer?
Those who are working in the industries which are who are exposed to more chemicals, and those who are smokers, and also the old age people, ma'am. Those people are the more potent to obtain this bladder cancer. So as a
Okay.
pharmacist, I may ensure them all those prevention methods and all those things to do regular checkups. So one of the easiest and cheapest checkup is the urine analysis. Certain
Mm-hmm.
times the blood may be not visible through the naked eye, but after urination, they may found the presence of blood, which can prevent the early stage, which can find the early stage of bladder cancer, which is highly treatable in the earliest stage.
Okay. Okay, dear. Thank you.
Thank you, ma'am.
Over to the next judge.
Hello.
Hello, good evening, ma'am.
Good evening. You have told about cyclophosphamide, right?
Yes, ma'am.
It acts as a bladder carcinogen.
Ma'am, the pathway, ma'am, it also affects the FDA just recently, or I believe, or 2 3 years back, they said that the PG1 pathway is mostly responsible for these cancers. So, and this cyclophosphamide also is found in certain levels, which previously patients have been taken, and also certain drugs like the diabetes 2 medicine has also been found, like pioglitazone, which are also linked with the bladder cancer because of the same pathway, which they go to PG1 levels.
Okay, is it a dose dependent? This ADR of cyclophosphamide.
It occurs rarely. It hasn't been found in many people, but they have said that it is due to the pathway which may crosses. So the people who are mostly risk are the old age people, ma'am. So
No,
we
no,
can say that it is also dose dependent.
okay, dose, and I think it is due to dose and duration of cyclophosphamide, it leads to bladder cancer. That's why I asked.
Yes, ma'am. That's why I'm saying, ma'am. It is also one of the factors.
Okay, the presentation was really good and you answered all the questions very well. Congratulations. Thank you.
Thank you, ma'am.
Thank you. Thank you for your presentation.
Thank you,
And
ma'am.
now, next to our ninth participant, Shanmadi from Annamalai University. Slot number SYCCONRX S4 Shanmadi from Annamalai University.
I am audible, ma'am.
Yes, you are. Your screen is also visible. Can start presenting.
Good
The
evening
time
to
starts
everyone.
now.
Good evening to everyone present here. Myself, Shanmadi of Form D third year. My presentation topic is about bladder cancer awareness. First of all, what is bladder? Bladder is a hollow muscular organ that acts reservoir for urine, which is located in the lower abdomen. Bladder cancer occurs when cells in the bladder start to grow without control. Optimizing bladder cancer treatment in pharmacist perspectives. Pharmacists play a crucial role in managing medications for treatment includes of accurate dosing, monitoring the drug interactions, counseling of patients, and it also involves of patients' progress and to stay updated on latest developments in bladder cancer treatments like new meds, treatment guidelines, and clinical trials. Medication management it involves of providing counseling and any side effects or interaction to watch for. Providing support to patient like providing education, reminders, and support to the patient to educate about the bladder cancer and treatment option and importance of early detection. The bladder cancer symptoms involves of blood in urine, frequent urination, painful urination, back pain. The impact of lifestyle modification on bladder cancer prevention. Smoking cessation.
Smoking is one of the most significant factors for bladder cancer. Healthy diet. A healthy diet rich in fruits and vegetables like whole grains of barley, millet, brown rice, and lean proteins of fish, yogurt, beans, beans can help to reduce of bladder cancer. Hydration. Drinking plenty of fluids, particularly water, can help dilute urine and reduce the concentration of potential carcinogens in the bladder. Maintaining a healthy weight. Obesity has been linked in an increased risk of bladder cancer. Regular exercise. Engaging in a regular physical activity has been associated with reduce the risk of bladder cancer. Routine health screens and checkups with healthcare providers can help detect the bladder cancer at an early age, which is more treatable. And also involves of limiting the exposure to the toxins like chemicals and dyes and industries. Thank you, ma'am.
Wonderful. Thank you so much. And now moving on to the judges.
Um, yeah, hello, Shanmati.
Hello,
Um,
sir.
yeah. So actually, your presentation is actually quite short and it is good. I would suggest you to, rather than using so many words, it's better to go with images or certain kind of pics which has been available in internet, right? So you could use those kind of images. It's little bit congested. I feel like so. Mm,
Okay, sir. Next time
yeah,
I will give it.
sure, sure.
Thank you,
So
sir.
one question which I wanted to post to you is about a TERP procedure. So when will a consultant suggest a TERP procedure for a patient? Is there any
Yearly
stages of
cancers.
what?
It is an option. Yearly cancers, sir. To remove your tumor from your bladder, sir. It's a
Okay,
procedure.
so when will the TERP procedure is indicated? Is there any stage whether we'll segregate the
Training stage.
which stage?
Yearly cancers, sir. Benign
Yearly
stage.
cancer. So benign stage. Okay, so you meant like stage 1 or 2.
Okay, yes, sir.
Okay. So in case if you wanted to have a TERP procedure for the patient who are gone over stage 2, so what will be the procedure you will kind of procedure you will follow?
This is a surgical procedure. Diagnose and treat the bladder cancer, sir. Is a cytoscope, sir. Thin tube. It is inserted into the bladder through the urethra to remove the tumors, sir, in the bladder lining.
Mm-hmm. Okay. Okay, fine. Thank you so much. Over to next.
Thank you.
Hi, Shanmati. Good evening.
Good evening, ma'am.
Okay, so bladder cancer awareness month is going on, right, in May month?
Yes, ma'am.
Okay, so to which group of people you think this awareness should go?
So, elder people like above 50 and men's, ma'am.
And males, is it?
Yes, ma'am.
Okay, so specifically certain males or all the males?
Above 50 ages,
Okay. Okay,
50.
Shanmati. Over to the next judge.
Actually, I do have one suggestion because we are
Yes, ma'am.
mainly focusing on prevention, right? So we have to focus on early adults because if you cross 50, then we can't modify such some factors. Okay, so we have to give proper awareness to adults also, not only for the one who is above 50 or 60 years. Okay,
Earlier. It's okay, ma'am.
yeah. Otherwise, your presentation is good, but you have to cut short your points. Okay, you have to improve on your poster. Next time you improve it. Okay, otherwise it's good.
Yes.
Thank you.
Thank you, ma'am.
Thank you. And our next participant, Suhana R. Nawab from KLE College of Pharmacy. Slot number SYCCON RX S480012. Suhana R. Nawab from KLE College of Pharmacy.
Good evening, everyone. Is my screen visible?
Good evening. Your screen is visible. You can start presenting. Your time starts now.
Good evening, everyone. My name is Suhana Arnawab. I am a PharmD fifth year student from KLE College of Pharmacy, Hubli. Today, I am going to present a poster on the theme The Impact of Lifestyle Modification on Bladder Cancer. So, bladder cancer begins in the cells of bladder, basically the urothelial cells. Lifestyle modification So, what will help the most? What is most important here to notice? So, quit smoking. It is a major risk factor for bladder cancer. Next, get your diet right. Keep your diet right. So, what should I include in my diet? Whole grains, fruits, beans, beneficial fats like omega 3 fatty acids, cranberries, nuts, etc. And most importantly, no junk food and maintain a healthy weight. Exercise regularly. Next, hydration is the key. Reach your daily water goal every day. Then be cautious of chemical exposures. So, what are the chemical exposures like benzidines and beta naphthalenes, which are used in the dye industry? So, you have to be away from those exposures. Next, seek help. Seek help from your healthcare providers. Know your symptoms. So, what are the symptoms? Those are urinary infections that don't respond to the antibiotics, blood in your urine. While you urinate, you see the blood. Then pain while urinating, tiredness, abdominal pain, lower back pain, needing to urinate frequently, urine incontinence, weight loss. So, keeping in with this, I conclude my presentation. Thank you.
Thank you. Moving to the judges.
Yeah, hello, Suhana.
Hello, sir.
So, your presentation is actually short and it's very much precise. It
Thank you,
looks
sir.
good. And yeah, you mentioned about this beta naphthalene, right?
Yes, sir. Yes, sir.
So where did you see this beta naphthalene? Whether we are using it in daily use?
Yeah, we are. I mean, beta naphthalene balls as we are using it.
Mm-hmm.
So
Okay.
it is also important, like, to like prevent as much as the exposure, as low as you use the beta naphthalene balls, like make it a low use in your home. Like daily, some people have this
Mm.
habit of keeping under the clothes and everywhere. So I don't think so. It is a right idea for that much exposure of naphthalene.
But still, for keeping away those cockroaches and other insects, right? So still they are keeping it, right? So
Still,
what
yes,
will?
still they are keeping, but I think there are other measures to prevent those uh, like pesticide. Sorry, to prevent those pests. So I guess we can use those. There are few bioenzyme content sprays and available. So for that, for cleaning those areas where these pests are prone two, we can use the bioenzyme cleaners and which do not have any risk of these cancers and which are free toxin free. So apart from these
Okay.
chemicals, we can use bioenzyme cleaners and everything.
Okay. So actually, I have seen persons using this naphthalene balls only for the smell. They are getting addicted to the smell of naphthalene balls.
Yeah, sir. I have also come across those individuals. Uh, but yeah, if we educate them correctly about how this can lead to these type of cancers, I guess that will help them to get rid of those chemicals.
Okay. Okay. Thank you so much. Over to
Thank
next
you, sir.
judge.
Hello, Suhana. Good evening.
Hello, ma'am. Good evening.
Suhana, your poster is very creative and it has a lot of creativity and colors. Very good. And your presentation
Thank,
also was very short and crisp. So I
thank you,
would
ma'am.
like to know that about see bladder cancer, like you told, of course, through exposure, right?
Yes, ma'am.
So, is there any chance of acquiring bladder cancer, not just from external exposure, but also something internally? Is there any
Something.
chance like that? Yeah,
Uh,
like not only from exposure to chemicals or smoking, is there anything that internally can cause bladder cancer?
yeah, ma'am. Junk food, chemical. Junk food, see, they add preservatives, so you can have cancer causing agents also in those preservatives as well. So if your
Okay.
diet is not right and you are having junk foods all day, like weekly thrice or weekly 4 times, you can get those chemicals inside your body and then they lodge into your bladder and cause cancer.
Okay, but a lot of people, especially in this generation, are having these kind of food only, right? So,
Yes,
what
ma'am.
measures can be taken in that case?
um, we have to educate them. Actually, preservatives are not in like fast food only, but there are few ready to eat meals nowadays, and they have those preservatives as well. Especially for bachelors, it is a major risk. So actually, we need to educate them to have home cooked meals. Or you can have fast food, but once the consumption of these foods will be better for them.
Okay, you answered well, but the answer I was expecting was genetics. So, usually, when bladder cancer runs in family, it is very common for people in the family to be at higher risk for bladder cancer.
Hello.
Okay, hello, am I audible?
Yes.
Okay, over to the next judge.
Hello. Hello,
Hi,
ma'am. I'm not able to hear you. I have network problem here.
Hi, Suhana. Can you hear me?
Hello.
Can you hear me? Suhana, can you hear me? Suhana? I think you can continue with the next presentation.
Okay, ma'am. So Hannah can start presenting. And our next 10th participant, Kandru Hari Chandra Prasad from Bagdevi College of Pharmacy. Kandru Hari Chandra Prasad, Slot number SYCCONRXS480016. Kandru Harichandra Prasad from Vagdevi College of Pharmacy. Slot number SYCCONRXS480016. You can start presenting.
Okay, thank you.
Hello. Hello, ma'am. I'm sorry I got disconnected.
Okay, that's okay. We move on to the next participant.
Yeah, really sorry about it. Network issues from my side.
Okay, that's okay.
I'm sorry for judges.
No problem, dear. We'll move on to the next participant.
Okay, ma'am. Thank you.
Hello, good evening, everyone. My name is Kandru Harichandra Prasad, Form D fourth year from Vagdevi College of Pharmacy, Warangal, Telangana. I'm here to present a case. I'm here to present a e-poster on the impact of lifestyle modifications on blood cancer prevention. Coming to the abstract, bladder cancer is one of the most expensive cancers to treat through the life course and also a high rate of reoccurrence. While cigarette smoking and occupational exposures have been firmly established as risk factors, it is less certainly modifiable lifestyle factors such as diet and physical activity plays crucial role in the bladder cancer etiology and prognosis. This literature review based on the PubMed research summarizes overall population based research in bladder cancer is growing and will be a key platform to inform patients diagnosed and living with bladder cancer, as well as their treating clinicians, how lifestyle changes can lead to the best outcomes possible. Coming to the introduction, in the US, bladder cancer is among the top 5 most common cancers, with an expected 76,960 newly diagnosed cases in 2016 and 16,390 deaths. It is also the most expensive cancer per patient from diagnosis to death due to part to its extraordinary high rate of reoccurrence. Established risk factors for bladder cancer encompasses three general areas: genetic and molecular abnormalities like specific oncogenes and tumor suppressor genes, chemical or environmental exposures, primarily cigarette smoke, and chronic irritation such as pelvic irradiation, or indwelling catheters. To date, the associations of diet and physical activity with bladder cancer risk are unclear, at point to possible beneficial effects of these modifiable lifestyle factors. This regard literature review will summarize the current evidence on the roles of diet, physical activity, and cigarette smoking with risk of bladder cancer, as well as any implications for potential interventions after bladder cancer diagnosis. Coming to the discussion, dietary behaviors may reduce exposure to known bladder cancer carcinogens or block the carcinogenic process, subsequently preventing or delaying bladder cancer occurrence. Fluid intake and vegetable and fruit consumption are of great interest in line with this notion. Vegetables and fruits contain many micronutrients and phytochemicals which may block or suppress carcinogens to modify cancer risk. One of these mechanisms is modulation of the phase 1 or 2 enzyme system to alter carcinogen metabolism and facilitate detoxification. This may be particularly important for the bladder due to altering exposure to carcinogens. Additionally, nutrients and phytochemicals from fruits and vegetables have been shown to have multifaceted anti-cancer activities. They can inhibit cancer cell proliferation and invasion via targeting signaling pathways and boosting the anti-tumor microenvironment by inhibiting angiogenesis and reducing inflammatory responses. Therefore, phytochemical-rich vegetables and fruits may not only be cancer preventive but also have cancer therapeutic potential. Overall, there is no convulsive evidence to support or dispute the notion of potential beneficial roles of dietary factors
1 minute
in bladder
more.
cancer prevention. Coming to the conclusion, in conclusion, dietary behaviors, particularly the consumption of vegetables and fruits rich in micronutrients and phytochemicals, hold promise in potentially reducing the risk of bladder cancer through mechanisms such as modulating enzyme systems, suppressing carcinogens, and prompting anti-cancer activities. However, current evidence on definitive role of dietary factors in bladder cancer prevention and survival in inconclusive, emphasizing the need for well-designed prospective studies. Additionally, physical activity may indirectly lower bladder cancer risk by aiding weight management. Further research is essential to better understand the interplay between diet, physical activity, and bladder cancer prevention and survival. And here are the reference citations where I referred for this e-poster presentation. Thank you.
Thank you, Hari. Thank you for the wonderful presentation. Over to the judges.
Hello, Ari.
Hello, sir.
Yeah. So as I said, as I mentioned, like a previous presentation, this is actually you could have used certain images rather than use giving us with a broad wordings. Okay, so you could have
Okay.
used certain kind of images, so it would be a little bit attractive and it would be quite interesting. And one thing which I liked from your presentation is the whole mechanism. The whole mechanism has been explained very much clearly. That is actually very good.
Thank you, sir.
And yeah, so in the conclusion, you just mentioned about this micronutrients and phytochemicals, right? So do you know
Yes.
what all the things comes under micronutrients and phytochemicals?
Yes, like micronutrients, like small amount of nutrients, vitamins, multivitamins, like
So
that,
that's
sir.
all the multivitamins comes under micronutrients.
Yes, yes. Not all the micronutrients, like all the multivitamins are few, like B6,
Okay.
few vitamins,
Mm-hmm.
and
Okay.
phytochemicals where the plant itself, by the phytochemicals, plant itself protect from the antimicrobials or antibacterial infections, etc. So,
Okay. Okay. So I just have a small question with you. A small question that is the prostatomegaly and bladder cancer are correlated, can be correlated, or is the BPH is an risk factor for causing bladder cancer? Do you have any idea about it?
no, sir, I don't have idea.
Okay, 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 fine. Thank you so much.
Thank you, sir.
So over to next judge.
Good evening, Prasad.
Good evening, ma'am.
Overall, your presentation was good. It seemed more like a paper presentation.
Thank you.
Yeah. So I noticed that you focused more on how the dietary modifications can benefit in bladder cancer, right?
Yes, yes.
Okay. So we can categorize the patients as a mixed diet and only vegetarian diet and non-vegetarian diet, right?
Yes, ma'am.
So in that case, the micronutrients which you were speaking about, how is it going to modify, the availability in these kind of patients when we categorize them? Is there any alternative? For example, if it's a patient only who's taking meat or only somebody who's consuming certain type of vegetables, what would be their, intake?
Intake, ma'am, like the main clinical pharmacist role is to make understand the patient to add up of their diet, like diet change according to the modification of the diet regarding the bladder cancer, supplements of nutrients, food. The pharmacist itself plays a major role in the like telling the patient to follow the dietary changes regarding the health of the like to prevent or for the bladder cancer.
Okay. Why I asked this, because in the conclusion you've given words like, saccharides and micronutrients, because when we are telling
Yes,
it to
yes,
the
ma'am.
normal patients, they would not have an idea what it is
Yes, yes, yes,
and
ma'am.
in which kind of diet they get this, right? So as a
Yes, yes,
pharmacist,
ma'am.
you need to come down to which food which in which
Yes,
they are
yes,
eating this is available, correct?
yes, yes, ma'am. Yes, ma'am.
Yes. Okay, that's all. Thank you, Prasad. Moving on to the
Thank
next
you,
step.
ma'am.
Hello.
Hello, ma'am.
In conclusion,
Good
you
evening,
have
ma'am.
weight management, right? Does the
Yes.
body weight have any effect on this bladder cancer, or the chemicals in junk foods only causes a risk?
Ma'am, weight means like, okay, junk food is the it is the it is also the major cause, but the normal human like heavy weight also may the cause for the bladder cancer, ma'am. May impact the bladder cancer.
How?
Like due to the overweight, ma'am. Like regarding the overweight, here in itself the junk food and normal heavy food also may cause may leads to the factors causing the carcinogens.
Okay, your presentation was really good. Thank you.
Thank you, ma'am.
Thank you, Hari. And
Thank you,
next
ma'am.
to our last participant, Prabhu Nirosha from TVM College of Pharmacy, slot number SYCCON RX S48003. Prabhu Nirosha from TVM College of Pharmacy. We can
Good
see your
evening.
screen.
Good
Yes, good
evening, ma'am.
evening.
Am I audible?
Yes, you are. Can start presenting. Your time starts now.
Good evening to the respected panels. Uh, my name is Nirosha. I'm studying in third form D from TVMCP College, Ballari, Karnataka. Bladder cancer occurs when cells in the bladder start to grow without control. Most common bladder cancer is urothelial carcinoma, which is a cancer begins in the uh, which is the cancer begins in the urothelial cells, which is the lining the urethra, bladder, ureters, renal, pelvis, and some other organs. And other than urothelial carcinoma, we can also have this squamous cell carcinoma and adenocarcinoma, but it is seen in very rare cases. And almost all bladder cancers are urothelial carcinomas. Urothelial cells are also called as transitional cells because they change their shapes. Coming to their epidemiology, according to based different regions, males are more prone than females. And across the globe, according to 2020 survey, approximately 5,73,000 people are affected, and among that, 2,13,000 people were led to death. And coming to the signs and symptoms, majorly we can see symptoms as hematuria, which is known as blood in urea, with or without pain, and frequent urination, that with- which is also with or without pain, and pa- pain in back, and urgent urination, and dysuria. Other systemic signs and symptoms are fever, night sweatness, and weight loss. Coming to the uh, coming to the risk factors, that is smoking, which is major, and personal or family history, previous cancer treatments it is also a risk factor, and chronic bladder diseases such as UTI may also a risk factor. Gender, where males are more prone than females, and exposure to chemicals, and birth defects, genetic defects, and increased age, especially above 50, may leads to the risk of bladder cancer. And diagnosis, there are different types of diagnosis. Among that, urine analysis is done, and USG, that is ultrasound scanning, and major the golden diagnosis of the bladder cancer is cystoscopy, where the biopsy is done and confirm the malignancy. And PET scanning and CT scanning are done to uh, identify the stages of the cancer. And stages, according to WHO, there are three stages: low malignance potential, low grade, and high grade cancers. And based on the stages, we can give the treatment. That is, management can be done in two types: non-muscular invasive disease and muscular invasive disease. And coming to the lifestyle modification, where majorly we have to ask the patient to quit the smoking if is smoker, and and we can advise patient to drink plenty of water, and stick to healthy diet, and limited exposure to unsafe chemicals and in the workplace. And we should ask patient to limit the consumption of alcohol and caffeine. Thank you.
Thank you. Now over to the judges.
Hello, Natasha.
Hello, sir. Good evening, sir.
Good evening. Yeah, your presentation was actually good. It was quite brief and regarding what is bladder cancer and all those parts are very. It's actually good. And
Thank
I
you,
have
sir.
one question with you.
Sir.
The same question which I'm repeatedly asking is what is your role? What is the role of a clinical pharmacist in managing the bladder cancer?
So if he is already diagnosed with bladder cancer, we can advise some lifestyle modifications, and we can counsel the patient. If he is not a bladder cancer, we can uh, arrange some social camps and all to get awareness among the people to know about the bladder cancer.
Okay. So this is so you mean like once when a bladder cancer is diagnosed, after that you will do all such thing, or it's before diagnosis? It's just a prevention like thing.
So preventions can be done before diagnosis, sir, and after diagnosis we can treat, sir.
Mhm. Okay, fine.
Thank
Thank you
you.
so much. Over
Thank you,
to
sir.
next judge.
Good evening, Nirosha.
Good evening, ma'am.
Your presentation was really nice. It's a very nice poster.
Thank you, ma'am.
Nirosha, can you list out some diagnostic methods which can be, used for collection of sample from the bladder?
Cystoscopy, ma'am, where we can collect the tumor, and we can diagnose.
Okay. Do you know the procedure? Do you have an idea about the procedure?
Have a little bit, ma'am, not deep. Where
Okay. So you can.
cystoscope is injected inside the uterus and then into the bladder and collected the uh, tumor, and can diagnose the uh, we can diagnose the malignancy, ma'am.
Okay. Okay, Nirosha. Over to the next judge.
Hi,
Good evening, ma'am.
good evening. The presentation was really nice. You have covered all the major portions regarding urinary bladder cancer. It was very well performed. Thank you and congratulations.
Thank you, ma'am.
And thank you. With that, we've come to an end of today's session. Thank you, all the participants. Really appreciate it. And I'm thankful to the judges, Dr. Anita, Dr. Aishwarya, and Dr. Sri Vishwapal. Thank you so much for joining us today.
Thank you so much for RS Doctor for giving this a platform for us. And yeah, just wanted to mention a few things. I was asking the participants regarding the pharmacist role or clinical pharmacist role in prevention or the treatment of bladder cancer, right? So let it be any kind of cancer. So the major role or major role what we have is the dilution part, dilution and infusion part. So this is a major role which we encounter in a cancer or a chemotherapy taking patients. So each chemo drugs varies with their dilutions and their infusion times. So this is a major role. Everyone has mentioned about the counseling part. Yeah, counseling part is fine, but still the treatment is very much important, right? So once when you start a treatment and treatment goes properly, and you can actually after that you can ask the patient to uh, do patient, and you can counsel patient about regarding the do's and don'ts of those chemo drugs. Okay. And the second point which I wanted to tell is, as a clinical pharmacist, again, tailoring the drugs and monitoring the side effect is very much important. So tailoring is through asking the patient's comorbid conditions and other such things, which is like patient histories is very much important for tailoring the drug. And side effect monitoring, basically when you hear about chemotherapy, the first thing which comes in your mind is always your side effects. So which patient will get with what kind of side effects? And still now there are many researches going on with the existing drug of chemo drugs about their adverse drug reactions and their side effects. There's lots of publications and lots of research articles are still now publishing many informations about chemo drugs and their side effects. So there are no healthcare professions to look after or take over all those works. Okay, so only the PharmD graduates can look after all those works. Um,
Huh? Hello. Okay. Thank you, sir. Thank you so much for adding valuable information and insight. Thank you so much, everyone. With this, we'll end our session. Tomorrow, day 7, will be the two competitions, case presentation competitions on the theme Rare and International Case Report and Dermatological Cases, Ophthalmology Case Studies, and another competition, quiz competition, on account of National Stroke Awareness Month. The topics will be anatomy and physiology of brain, recognizing stroke symptoms, the importance of timely stroke treatment, stroke prevention strategies, advances in stroke research and treatment. The results for today's competition will be announced on June 1st, valedictory ceremony. Stay tuned for that, and thank you so much for participation. Really appreciated. This is Jennifer Milsey, and you're in the 4th International Conference of RX Doctors and Steer Career Conference 2024, Series 4, Episode 80. We'll see you guys tomorrow. Thank you and good night.
Thank you. Bye.
Thank you.